Do you frequently feel like your heart pains sometimes? Or maybe your child often looks pale and gets tired quickly. Imagine your little brother who used to run around the playground now just sits quietly, complaining of bone pain. These could be signs that something isn't right with the blood. Acute lymphoblastic leukemia, or ALL, is a type of cancer that starts in the bone marrow, where your body makes blood cells. It causes too many immature white blood cells, called lymphoblasts, to grow. These cells don't work properly and crowd out healthy blood cells. Think of it like a factory where too many broken cars are being made, so no space is left to build the good ones. That's why people with ALL feel weak, get infections easily, or bruise often. What causes a LL? Well, scientists still don't know all the exact reasons, but it's not something you catch like a cold. It happens when changes, called mutations, occur in the DNA of young white blood cells. These changes make the cells grow out of control. Imagine a car's gas pedal getting stuck. The car just keeps going and won't stop. That's what happens with these cells. Some things might increase the risk. Being exposed to high radiation, like in nuclear accidents, certain chemicals, like benzene found in paint or glue fumes, or having certain genetic disorders like Down syndrome. Also, if a family member had leukemia, the risk might be a bit higher, but most people with a LL don't have a family history. Have you ever felt unusually weak for no good reason? Or noticed tiny red spots on your skin that don't hurt or itch? These could be signs of a LL. Because the bone marrow is filled with abnormal cells, it can't make enough normal blood cells. So low red blood cells cause anemia, making you look pale and feel tired. Low platelets lead to easy bruising or bleeding, like frequent nosebleeds or small red dots, called petechiae, on the skin. Low healthy white cells mean infections. Maybe your kid gets colds every month. Bone pain, that's from too many cells growing inside the bone. Swollen glands, fever, or even a bloated belly might happen too. If a child stops growing or loses weight without dieting, it's worth checking with a doctor. How do doctors know if someone has ALL? First, they listen to your story like, "My son has been pale and bruising for weeks." Then they do a blood test, a simple prick to check blood cells. If something looks odd, they move to a bone marrow biopsy. That sounds scary, but it's a quick procedure where the doctor takes a tiny sample from the hip bone. They examine it under a microscope. Finding too many lymphoblasts confirms. After diagnosis, treatment usually starts fast because ALL grows quickly. The main treatment is chemotherapy, strong medicines to kill cancer cells. It happens in phases: induction, to get rid of most cancer, consolidation to finish the job, and maintenance, a lower dose for months. Many kids go to the hospital often, but some treatments can be given at home. Sometimes radiation, or a bone marrow transplant, is needed if the cancer is tough to beat. Can we prevent ALL? Right now, there's no sure way to prevent it, especially in children, because the exact cause isn't clear. But being aware helps. Avoid unnecessary X-rays or radiation, especially during pregnancy. Limit exposure to harmful chemicals like pesticides or benzene. While we can't change genetics, early detection is powerful. If your child seems constantly tired, bruises easily, or has unexplained fevers, don't wait, talk to a doctor. Think of it like checking your car's engine light early. Catching ALL early doesn't prevent it, but it can lead to better treatment and outcomes. Living a healthy life helps the body fight back, even if we can't stop the disease entirely. What's new in the fight against ALL? Great question. Scientists are making big progress. One exciting advance is immunotherapy, training the body's own immune cells to attack leukemia. CAR T-cell therapy is like turning your immune cells into smart missiles that find and destroy cancer cells. It's used in some children and adults who didn't get better with chemo. Another hope is targeted drugs that attack only the broken parts in cancer cells, sparing healthy ones, like using a key that fits only one lock. Also, doctors now study the genetics of each patient's cancer to choose the best treatment. This personalized medicine means fewer side effects and better results. Thanks to these advances, survival rates for children with all have climbed above 90%